natural, so don't worry about it. Or I only used it during the first trimester, so it's not that big of a deal. There are all sorts of statements that people make about weed use during pregnancy, but what does the science actually say? So today, I, a drug scientist, am going to break it down for you. So more and more people are saying that it is basically harmless to use weed during pregnancy. Like in the past, it was about 5% of women, and now we're about in 1 in every 5 women say that it's okay to use weed during pregnancy. And we know that the more likely somebody is to say that it's harmless, the more likely somebody is to use that. And we do see that a lot of people continue to use weed during pregnancy. So of people who used weed prior to their pregnancy, about half of them continue to use weed sometimes, and about 1/3 of them are like daily users. Now, people are rarely starting, so there's not really a group of people out there who are like, I'm pregnant, now is the time to use weed. But what we see is that a lot of people struggle with actually being able to quit weed and might think that it is completely natural and normal. Now, if you've watched any of my previous videos, you know that one of my top pet peeves is when people say that because it is natural, that means that it's pretty much harmless. No, that is not true at all. Like opium is natural. Death cap mushrooms are natural and they will kill you in terrible ways. So natural does not mean harmless. And a lot of people are kind of putting those two together. Like, oh, well, weed is a natural herb, which means that it's not going to have any side effects, that it's not problematic at all. And that is not true. Any drug has pros and cons. So even though it is quote unquote natural, that does not mean that it does not have problematic effects, including during pregnancy. So let's describe what science actually found here in terms of how weed affects pregnancy. And there's kind of these two main issues going on. One is how weed is affecting things like the actual pregnancy, and two, how it's affecting the child after it is born. Now, there are tons of other questions that you can ask here. So like, how does weed affect fertility? Or how does weed affect things like breastfeeding? Like, can that actually go into the infant? And that is not what I'm talking about today. I'm specifically talking about weed use during pregnancy and how that affects the fetus and eventually the child. Now, important caveat, what I'm going to talk about first is found with regular users, so women who had used at least weekly. And we see that those regular users commonly have kind of increased risk of stillbirths, increased risks of being born premature or having to spend time in the NICU. Also, studies that show that babies born to women who use cannabis regularly during their pregnancy had kind of this higher pitched cry, like a specific different type of cry, although the primary studies from that were done in the 1980s, so I'm not entirely sure what's going on with that. And also might have an exaggerated startle response. Also, like the actual development of neurons. So basically how long the axon is growing and how quickly it grows, that might be hindered by weed as well, weed during pregnancy. We also see that there are a lot of kind of like behavioral issues that are linked to cannabis use during pregnancy. So we see things like the development of psychopathology. So maybe an increase in things like depression and anxiety and maybe even personality disorders. Children of mothers who regularly used weed also have kind of lower cognitive flexibility, so they're not likely to adapt as easily. And they also have things like sleep problems and maybe an increased diagnosis or rate of diagnosis for things like ADHD. And in animal studies, we see that prenatal weed is actually linked to things like impaired social interactions as well as like sensitivity to a stress response. So maybe you're more vulnerable to stress. Does the trimester matter in terms of when people are using? Like, does it make it better or worse that they're using early or later on? Well, in this case, it seems like trimester does not matter. Like, there have been problematic outcomes associated with every trimester of pregnancy. And what about the amount of use? Well, there have been more recent studies that say that like people who use it not regularly, but kind of every once in a while. So the average number of times during a pregnancy that somebody used it in this study was about 33 times. So not constant, maybe once a week or less than once a week. What we saw in those people is that women who used less than regular, so low level use, was not linked to any problematic outcomes. So that's what we know, which is not actually that much, because first, you can't really do proper experiments here with humans. Like, you can't assign somebody to use weed while they're pregnant and see what happens. And so there's all of these other factors that are correlating with whether somebody is more likely to use weed or not during pregnancy. And you can't really control for them. You can control for them statistically, but you're never actually running like a true experiment in this case. So in terms of like how often you use or during what trimester, we have very little out there, and all of it is correlational. So all of it is just saying like we see that on average, people who use kind of every once in a while versus regularly don't seem to have problematic outcomes if they are smoking or using other ways during pregnancy. But the more often you use, the more likely it is to become a problem. That's basically all we can say at the moment. And since we can't run those studies, that's pretty much all we'll be able to say in the future. So the medical advice that most associations give is basically like just don't use during pregnancy. And that's what doctors typically say too. And when people poll doctors, what you actually see is that like they actually report that they have no idea with how to deal with the situation, which kind of makes sense because it is a legal minefield. In the United States, we have laws that basically say, like, yeah, you have to report parents to doctors if you suspect child abuse, which can be things like drug use during pregnancy. And yeah, well, doctors are trying to deal with the situation. Also, pregnant women are trying to deal with the situation too. So they're trying to actively figure out, like, is this as harmless as my friend says it is? Like, what is actually out there? In a lot of cases, doctors say that they don't know the current research. And it's like a catch-22. Like, I typically tell people to talk to their doctors for additional advice. Like, I'm just giving you information. I'm not your doctor. I'm not giving you medical advice. So talk to your doctors if you're curious about this. But in this case, like, I don't necessarily actually want to do that. Like, there are extremely problematic legal ramifications of even just like asking these questions. And then you have the problem that like this is a messed up system to begin with. This is far more likely to occur in black and brown people than it is to occur in white people in terms of the doctors like reporting them for potential drug abuse issues during pregnancy, like 4 times more likely. So some people are just less safe asking these questions in the first place. So what are pregnant people supposed to do? They can't actually ask these questions to people. They don't know the answers to them. They're hearing competing information. And this is a decision that they have to figure out. And then add in the joys of stigma here. So people are less likely to report that they're doing it if they know it can have legal consequences, but also if they know that people will shame them. And there's a stigma of using basically any drugs during pregnancy, including things like prescribed medications that you've spoken to your doctor about. And so maybe people are just more likely to continue to use because they don't want to get started on another medication that their friend is going to shame them for. So what are pregnant women to do? Well, I honestly don't know. I'm not sure what advice I can actually give in this situation other than like you have to navigate it for yourself, and at least there's the information out there. So like the TLDR is basically like no use is best. It doesn't matter what time you use, and most of the findings suggesting that there's any sort of effect are for regular use, and they kind of are terribly done in the first place. So there's all the information out there. Do with it what you may. And like, it'd be great if we could bring this up casually so that the people who need to hear it can hear it without shame or stigma.